we'll move on to our item number 11, which is our presentation from LARCA. So far, guests from LARCA could approach the public comment table, and we are ready for your presentation whenever you're ready.
Okay, good afternoon, commissioners. Bennie, Tinson, Executive Director, Licensed Adult Residential Care Association.
Good afternoon, commissioners. Salaneka Smith, Director of Member Services for the Licensed Adult Residential Care Association.
Thank you so much for having us back to present to you today. The Licensed Adult Residential Care Association is a 501c3 community-based nonprofit membership association representing more than 400 state licensed adult residential facilities and residential care facilities for the elderly. These facilities are more commonly known in the community as board and cares. LARCA member facilities provide 24 hours, 7 days a week, care and housing to thousands of low-income adult Angelenos living with serious mental illness and other co-occurring disorders, including substance abuse disorder. LARCA's mission is to serve our members and the community. LARCA champions resources for state licensed adult residential facilities and their residents, building increased public awareness and support for housing and health solutions that serve vulnerable low-income adults and the elderly living with serious mental illness and co-occurring disorders. We're very grateful to be here today and thankful for the Department of Mental Health, the Department of Behavioral Health now, and our forming with a partnership with the National Alliance of Mental Illness of Greater Los Angeles County. Today, we would like to walk you through a presentation. We would like to inform you of the award that LARCA received from the Los Angeles County Affordable Housing Solutions Agency, talk a little bit about the Community Marketplace Hub pilot project that we will be working on. We will review some of the outcomes and also walk you through the implementation plan. And then lastly, we will go through the next steps. You can go to the next slide, please. So LARCA was awarded $500,000 for a one-year period to fund a pilot project with a start date of July 1, 2026 and goes through June 30th, 2027. We will be implementing a pilot project with LARCA members who collectively have 1,000 beds, and we will be working with LACASA, which is the Los Angeles County Affordable Housing Solutions Agency, on this project. We can go to the next slide. So LARCA will design a community marketplace hub that organizes and activates the use of ARF, adult residential facilities and residential care facilities, as a housing and as a core component of Los Angeles County's affordable housing and homelessness prevention system. The project will provide technical assistance to operators to unlock beds, to fill those empty beds, streamline placement pathways, and align funding streams to support sustainable housing. The goals and intended outcomes is to activate the underutilized state licensed ARS and RCFEs capacity and increase placement rates into community-based housing. This will reduce discharges to homelessness from hospitals, jails, and institutions, while also increasing utilization of Medi-Cal, AIM, assisted living waiver, and other funding streams before local dollars. It will also establish a scalable, replicable model for coordinated housing access across jurisdictions. We are fortunate to be able to work on this pilot project. We believe that it will be innovative, and Salaneka now will go into more details in terms of the pilot project.
Thank you very much, Benny. And as Benny stated, we received $500,000 from LACASA to be a partner in the ongoing issues to address the multi-crises that Los Angeles County is facing. And we're very, very grateful. The scope of work, which will be the next slide we can go on to, is the initiative is to activate existing infrastructure to combat homelessness, improve care coordination, and to prevent closures of state licensed ARFs, the adult residential facilities for 18 to 59 years of age, as well as the RCFEs, the residential care facilities for the elderly for age 60 and above. As we know, state licensed ARFs and RCFEs are a critical component for housing that is permanent, supportive, stable housing. It can also be interim depending on that resident's needs, but it is a critical component of housing for the COC here in Los Angeles County. And LARCA will design and implement a community marketplace hub that organizes and activates the use of ARFs and RCFE housing as a core component of LA County's affordable housing and homelessness prevention system. Rather than building costly new units, this approach rapidly increases the functional housing supply by mobilizing existing assets, providing technical assistance to operators to unlock those beds, streamline the pathways for care, and align sustainable funding streams. So we'll move on to the technical assistance focus. As we know, the LACASA award was for technical assistance to develop this pilot project, and we will be focusing on capacity building. We know that developing local implementation playbooks, we will be training our providers on diverse funding pathways such as CalAIM, the Assisted Living Waiver, the Behavioral Health Services Act funding, and supporting critical data infrastructure. We will also implement support by stand-up referral coordination workflows. One thing we are aware of is that LA County has multiple agencies. It's a very complex and layered system, and we are working, and we're very, very grateful and excited to be a partner with LA County to help streamline these pathways, to connect, to better provide better coordinated care for everyone in the COC. And LARCA is happy to play a role in that and work with the agencies of DHS, the Department of Health Services and ODR, the Department of Mental Health, and other housing systems to operationalize the placement pipelines, because they are coming from so many different areas. And it's important that we operationalize it, streamline it, and better coordinate the care. We are also seeding innovation, and that's a very critical component to this LACASA grant, that we're seeding innovation to execute the community marketplace pilot hub project. And with the successful outcomes, we hope to replicate this, because this pilot project will demonstrate the effectiveness of improved care coordination and outcomes that are better for the individual. And if this is successful, we can replicate this across the county as well as across the state. Next slide, please. So what are those pilot project outcomes? We know that it is critical to utilize empty beds today, as we are still in a crisis situation. So those empty beds, we're going to utilize those. We're also going to, as we stated, improve care coordination. And we're also going to prevent the further closure of ARFs and RCFEs by improving their rate of reimbursement. And so through the vacant bed, through the vacant bed utilization, we're focused on the production and utilization of these underutilized beds. And so our current pilot project has identified 7 to 10 facilities across LA County in different service planning areas, representing a total of 1,000 beds. And this expected vacancy rate it's about 25%, meaning a quarter of these facilities are currently vacant. We want those beds filled now. And year one, we're targeting 40 beds. And so that care coordination is going to focus on 40. And year two, this is our hope. And of course, La Casa may provide funding for us in year two. That's something that we will look at later as we continue with the pilot project. But it is our goal to increase that target focus to 110. So if we can expand year two, we will have affected 150 beds total, but year one is 40. And with the care coordination, homelessness prevention between the operators of these facilities, as well as the managed care plans, those county agencies, as well as city agencies. We have a county that has several cities inside with its own care coordination or its own continuum of care, like Pasadena, Burbank, and Long Beach. So we plan to engage productively and effectively, not only with the county, but other city agencies as well. And so as we stated, the pilot facilities will include a total of 1,000 beds across about 7 to 10 facilities. We are expected to improve the care plan development. Right now, we know that sometimes a resident may come from ODR, or they may come from a justice-involved environment, or they may come from a skilled nursing facility. They may be under conservatorship. All of these components are important for us to coordinate to ensure that their care is improved, it is monitored, and it is adapted if it needs to be. And that's what we will do. So we're going to strengthen the coordination among the healthcare and the housing systems. And that's what we are all here today talking about, integrating more, working together more to remove some of these silos and fragmented departments, right? And work together better. So that's what the care coordination is about. And what is the goal? To improve the health outcomes for the residents all throughout their lives, not just the initial 6 months or first few months, but we want to improve their health outcomes throughout their situation. And that's going to make it person-centered care by listening to the residents, by understanding what they need, by involving the operator more to be aware of what that managed care plan offers those residents. So that's important for us. And we want to do it through the lens of cultural competency as well. And so that's what improved care coordination will be. With regard of rate preservation, we have unfortunately seen some of our state licensed facilities shut because they are unable to continue to operate at such a low rate. As we know, the rate for social supplemental security income recipients, the rate of reimbursement paid to operators in Los Angeles County or California, it's about $46.60 per day. And that's very challenging for operators to operate a 24-hour stable, 3 meals a day, snacks, laundry, facilities, medication management on such a low rate when we also consider the cost of living, the cost of rents to do business, and inflation today. So improving that reimbursement rate will prevent the further closure of additional facilities that are really critically needed right now. Next slide, please. We'll look at the implementation plan. And as Benny stated earlier, the project starts July 1, 2026 through June 30th of 2027. And as you can see, we have 4 phases. And some of those phases are overlapping with each other, but they are 4 distinct phases. And phase 1 currently is our mobilization program. And that is us in evolving our internal organization as a nonprofit association, working with our board. And so that's what we are undergoing right now. We are confirming our pilot plans. We have had extensive stakeholder engagement meetings with our pilot facilities to confirm their participation, and we'll continue that. We will also have system engagement during phase 1, which we have also undergone as well with our engagement in meetings with DHS and ODR, as well as outreach we have had with Los Angeles City Council Districts 4 and 13, as well as with the Department of Mental Health. And so we will continue with our engagement during this phase 1 period, as well as our membership development for phase 1 is very important. We have undertaken a membership growth campaign currently where we are targeting 1,000 new beds in the Long Beach continuum of care area of the county, as well as with some of our larger corporate owners with multiple facilities. So we're targeting 1,500 beds there. We are also working on communication messages with our coordinators to develop so we can therefore increase even more membership. And so members know, what does it mean to be a LARCA member? What services do we provide, and how can we help with your operations and your residents and staff? That's phase 1. Phase 2 begins September 1st, and it'll run through the end of this year. And that's to build capacity. And with building capacity, we're implementing the matching protocols. We are engaging in training and education of our partners. And we are also engaging with payers, whether we know there are about 15 different payers in LA County. And so therefore there is engagement that's needed, and it's going to be different for the different payers. And that's what we are going to be involved in for phase 2. We are also identifying those key referral partners. We oftentimes hear that referrals can sometimes be blocked, or there are issues with placements, and we want to work on that to ensure that there is a smooth pipeline and access of referrals timely as well. When a person needs a bed, we can identify that type of facility that could provide the service for them, whether it's maybe a specialty in memory care or something else that that person might need. That's what we're going to be focused on, is identifying those key referral agencies and strengthening those as well. And we also want to introduce innovation options. We oftentimes know that our operators have been operating for, in many cases, decades. They have quite a bit of experience. They have quite a bit of knowledge. And so their feedback is important for us to listen and take in some of those options for innovation and apply those if we can. So that's going to be in phase 2. We are also going to continue to evolve our membership by growing it even more. And we have a 3,000 bed growth for that. We also want to improve our membership database to be able to offer more information about our membership, so where we can easily extrapolate that information when needed, especially for referrals. And so we'll be able to identify, we have some facilities that specialize in maybe our TAY population. Other facilities may specialize in folks where English is not their first language, maybe veterans. And so that's what we are doing with building up our membership database as well. And our communication plan, again, so people understand where it's across our digital platforms, in person, hybrid meetings, but we want to be clear that they understand what LARCA means to them as a member. The next phase, we've got October 1st of 2026, and this will run through March 31st of 2027. We're going to test those placements, right? This is where we conduct the placements, and we're going to set that referral workflow to identify who are all the people involved with the care of this individual. So then we know what their roles are. And so this is going to be the critical time for us to do those test placement. And we're going to sequence those payers, be aware of what reimbursement rate this agency pays, what reimbursement rate this agency pays, and consolidate that so we are aware and we can sequence that for better care. We're also going to engage in contracting with our systems and our agencies. We're going to also provide the funding that's necessary through their reimbursement rates that are going to go up, be increased, because we know that we're going to be focused on CalAIM and those community supports. And so that's going to be funded. We're also looking at additional funding because we've been funded before, as you see, by the Hilton Foundation and others. So we're going to continue to engage with some of our other funders so they're aware of the work we're doing. And then we're going to test the innovation of what we have in terms of feedback from our operators, feedback from our residents, and adapt to what we have learned so far in the pilot project. So that's what we'll be testing as well. With regard to our membership development, we're going to connect to that marketplace hub through the voice of our operators. We're going to work with the voice of our residents. We're going to have engagement sessions in person as well as hybrid with our operators and residents, so we can be aware and mindful of exactly what this project means to them and adjust accordingly, again, based on their feedback for what we should and shouldn't do. This is person-centered, and we want to make sure that we keep the resident and the operators first in mind so we can ensure that we're serving the community to the best of our ability with this pilot project. The last and final phase of this, which will end on June 30th, 2027, is to report and evolve. And we will be producing regular reports and reporting to LACASA and also to our key stakeholders and our advisory committee that's going to be involved with overseeing and continuing to monitor what we are working on. We want to improve the program based on that feedback, and if possible, develop a scale approach so we can replicate this across the county. And of course, that also means that we will be engaging with homeless services and housing, managed care plans, Department of Mental Health, the Department of Health Services, and the Office of Diversion and Reentry, as well as others. And we are going to continue with our member education and training by collecting that feedback, analyzing that feedback of the pilot program and making that information available and accessible to everyone so you can understand how this pilot project occurred. Next slide, please. All right, I'll turn it back over to Benny.
Okay. In terms of moving forward and next steps, we would appreciate any letter of support as we are going after additional funding and getting additional funding. If there's a letter of support that we ask of this commission, we would ask that if you could provide that letter and that support, and also the Department of Behavioral Health, if you could also show that support. And then also encourage the county agencies to work in partnership with us as we move forward with implementing the pilot project. So we'll open it up now if there's any questions.
Thank you very much for your presentation. I have a few questions from commissioners here. Commissioner Pruder, Commissioner Friedman.
Thank you. Thank you for your presentation. My question, I just want to know, I hear your ask on a letter of support. I want to know if you have it now, great. If not, if you can provide it to me, just data on LGBTQ population served by your organizations. I just would love to be curious to know that.
Yeah, we'll be happy to get that for you.
Thank you.
Thank you, Commissioner. Commissioner Friedman.
Just curious what you can do about that $46.60 daily rate. What, excuse me. What can you do to change that? Yeah, I mean, it seems like a ridiculous amount of money.
Yeah, so we know that for the SSI recipients who rely on public benefits, that is set by the federal government as the reimbursement rate of $46.60, which has caused the problems because it's unsustainable. And that's why we've had facilities closed. That's why this pilot project is going to explore how do we connect to the CalAIM services, those community supports at the state level, which will increase their reimbursement rate and align it more closer to like the rates of ALW. There are 5 tiers, and that's what we are identifying, how we can increase that rate, even though the federal rate is already established and we know what the federal government and its administration looks like right now in terms of being able to change that. So we're exploring these other options, and we have the power and the authority within our state and within the existing contracts we have with our managed care plans and the legislature to do what we can to match those CalAIM rates to lift that level of reimbursement and sustain their facilities and prevent them from closing and provide better care, sustain their staff, pay their staff higher. It'll bring a whole host of in with this pilot project if we can demonstrate it.
Good luck. Rooting for you.
Thank you.
Thank you very much. Commissioner Stevens? Did someone else over here add it? Oh, I'm sorry. I'm not used to the whole thing. Okay. Yeah. All right. I will go. Commissioner Olson.
Thank you. Really great presentation. And I love what you're proposing. I have a couple of questions. So we talk about it being a community hub. Does that mean that the community is able to self-refer?
Yeah, the first phase of this, we will be doing this just without the software to test the pilot. And so year 2 is when we've met with several software companies to develop it. But yeah, this will be accessible to the public in all referral system and placement organizations.
That's great. And when you say referral, so just so I understand, because I hear that we're looking to match people to beds, but we're also looking to match clients to funding sources. So will the referral focus on also locating the funding source and then locating a bed that matches that funding source? Because I see there's some education to providers around funding source. So sorry, I'm trying to understand how that would work. It sounds amazing though.
Oh yeah, it'll be a combination actually. Okay. Depends on where that referral is coming from, right? If they are under conservatorship, if they have to be justice involved, they're going to have placement, distribution already established, and they'll be working under some type of situation, right? But if they're let's say a family is looking for a facility for their son, as Barbara mentioned earlier, then they definitely can, right? And so it's important for us to have that face sheet, and many of our operators do. They do sort of an assessment and an interview to determine what is their healthcare coverage right now, what is their source of income, is the family involved, do they have a pension on top of that? So that will be both. It'll happen in both areas.
Amazing. And then, so the rate increase, that funding would come out of the $500,000 award?
No.
Okay.
So,
Sorry.
Oh, no, it's okay. The rate increase will come from identifying those managed care plans that those residents are enrolled in and optimizing those managed care plans, right? But because their rates right now, there are 5 tiers, and depending on their acuity needs, and that's what's so important to ensure that their assessment is done accurately, their acuity is determined to match what the operator should be reimbursed for their care. That already is much higher than where we are right now. And so that'll be through the managed care plan via Medi-Cal.
And the matching protocol. So the matching will be done through LARCA. Is that correct? Will LARCA be the agency that is matching beds?
Yes.
Okay.
Mm-hmm.
And then they would obviously be coordinating with HSH, LASA, the other agencies.
Mm-hmm.
Okay.
Mm-hmm.
And I see here the system engagement only identifies 2 of the 15 council districts for the city of LA, CD4 and CD13.
Mm-hmm.
I'm just curious how we came up with those 2.
Well, we've had more extensive engagement with them.
Okay.
We've had really great feedback, but we've also met with other members of the city council. We do intend to meet with each of them.
Okay.
And we've met with the mayor's office as well.
Amazing.
Yeah. The other thing that's really interesting is both of these districts, CD4 and 13, they have significant hospital clusters in them, and they have lots of placements. They have skilled nursing facilities adjacent to these hospital clusters, and there are also state licensed ARFs and RCFEs that are near these hospital clusters. And so focusing on them, we think would be really ideal to improve that care coordination, and be able to touch all of those payers.
Because I thought maybe that the 7 to 10 facilities might be in those districts, but it sounds like they are also probably close to those districts. The 1,000
Yeah,
beds.
they're in those districts,
Okay.
but we also have identified others as well.
Okay. And I think I'm so sorry. I'm
Oh,
trying
no
to
worries,
take all your
please.
time.
No, don't.
One more question. Nope, that was it. That was all.
Sure.
Thank you very much. I really appreciate your presentation. Thank you.
Thank you, Commissioner. Commissioner Subinudis.
Yeah, thank you again for such a detailed presentation. I think I, along with many others, are excited to see how the pilot plays out. It sounds like we have a better understanding of where the increased reimbursement comes from. In addition to the initial data on LGBTQ population, could the commission also get data on 18 to 26-year-olds? And then I imagine as part of the consistent updates and reports that the commission would likely be a recipient of those as well.
Sure.
Yeah, thank you.
You're welcome.
Thank you, Commissioner. Commissioner Stevens.
I am always impressed, and I just continue to be impressed by both of you. Benny, you are so fortunate to have her. I just need to shine a brighter light on her. Oh, yeah. So here's the thing. So I'm not going to ask a lot of questions, but in reference to data, does LARCA has data broken down by service plan and areas, race and ethnicity, age, as well as the co-occurring disorders? And since the Behavioral Health Commission is responsible for oversight to the public behavioral health system, understanding who is accessing these placements and where gaps remain could be just as important as the overall number of people that you serve it. So that's one. And then when you mentioned those empty beds, it became very confusing for me about like the 1,000 beds. And it seems that you have discovered these 1,000 beds.
So 2 things. Yes, regarding the data, we are building that in because we know that it's effective, it's efficient, and we will incorporate that into the pilot project. That specificity is key to understanding where the needs are, right?
Disparities.
Yes.
Mm-hmm.
So we will do that. And then your second question, you said about.
Well, the service planning area, where are these, where folks, the needs are?
Yeah. So the 7 to 10 facilities we identified, they have a total of about 1,000 beds. So some of them could be 230 bed facility. So they represent 1,000 beds.
Right.
That 7 to 10.
And that's to be appreciated, but it'd be helpful to clearly understand where are they located.
Oh, yeah,
Because that's
for
how
sure.
we identify
Mhm.
where the disparities are, or
Absolutely.
the unmet needs.
Yes.
I'm really happy that you talked about that $46, and I think that we've heard about this $46 going back to Caroline Kelly and Brittany Wise. Brittany Wise. And I had this. And Barbara Wilson. And so I always want to lift them up because we've been having this conversation just so that this Behavioral Health Commission know, we're hearing this. Many of you may be hearing it for the first time. I've been hearing it for years. And this is a moment now to really address the needs in the community. And so I greatly appreciate you for that. And particularly around talking about the CLC, because right now, and we talked about that CLC earlier, and as you can see, with all of the challenges that we're currently facing, that is not going to be helpful to you. It's going to be more harmful to you. So I just think that we need to uplift that. The last thing that I would say is many licensed residential providers serve individuals with co-occurring disorders and mental illness and substance use disorder. What operational challenges are providers reporting today? And if you don't have that information, I would hope that this is something that you would consider. What are they reporting today? And for example, are they experiencing issues related to safety, medication management, contraband, tenancy laws, or staffing? And what supports are available to help providers successfully serve residents with complex behavioral health needs?
Yeah, and a couple of things, just going back to the facilities we've identified, just to share with you. So the MacArthur Park area or downtown LA is where one of the facilities is located. We have one in the Vermont Pico area. Long Beach, we've identified East Hollywood, Linwood, South LA, and the Beverly Wilshire communities. So it's sort of crossing several of the county districts. With regard to some of the challenges our operators are facing, it's more than just the financial. That's obviously the largest one, but it's also a lack of coordinated care among all of the systems and also a lack of engagement. They're not even aware to some degree in terms of like a managed care plan. Someone may be on a health net plan or an LA care plan. The operator may not be aware a lot of what that person's condition is. And so being able to speak to them more, incorporate them more so they have a better understanding. So sometimes a dialogue is occurring between the resident and that managed care plan or the other entity and the operators not being included. We do see substance use rise. That's quite significant. We're hearing that no matter what district or service planning area, it's deeply, deeply affecting a lot of the residents, especially with some of them resulting in violent behavior. So I think that care coordination, substance use issues are there, the low reimbursement rate. And I think just being aware proactively more, understanding they want to see referrals come in more. So this is why we want to design a system where it is centralized, where everyone knows, no matter where you're coming from, whether you are in a skilled nursing facility, you're justice involved, you're TAY, but there is one pipeline that can coordinate that. And then that allows for operators to have a way to assess, interview, and say, this works out well. I've got an empty bed right now and this person here. So we want to be able to have a better system for referral, that care coordination and communication, substance use issues, and that low reimbursement rate.
Thank you.
Okay, thank you, Commissioner. Any other comments? Yes, Commissioner Weissman.
Just sharing my pride in your presentation and all the progress you've made to date. It's really incredible to see that this started as conversation and complaints from stakeholders like Barbara Wilson. I don't know how many years ago that was. And it's turned into a machine that I hope will be really effective in solving this. And I'm just wanting to make sure we get you that letter of recommendation or support as the Behavioral Health Commission to the greatest extent and fastest possible response we can offer.
Thank
So
you.
I'll make a motion that we prepare one for you.
I'll second this.
Okay, we have a motion and a second to write the letter. And is there any further discussion on that on the motion to write the letter of support?
Well, I would like to recommend Commissioner Wiseman in the crafting or drafting of the letter because she's been so involved for so long that and the connection that she has with LARCA in order to ensure that the letter is exactly what is necessary and needed. Thank you.
Commissioner?
Happy to.
Okay. And any other further discussion on the motion? I think that if, depending on how quickly you can get that done, if we get that to the next executive committee, we could approve it and and then send the letter forth. If everyone's in agreement with that.
2 weeks.
Okay.
Thank you.
End of week would be fine for me.
Okay.
Go, girl.
Great. Wow. Welcome back. I'm so glad you're back and refreshed and smiling. Okay, thank you very much. Okay, is there so if there isn't anyone that's opposed to that motion of us of Commissioner Weissman drafting that letter and sending it to the executive committee for its review and approval in 2 weeks, then seeing no objection to that, then the motion is approved.
All right.
So you'll get
Thank
your
you.
letter in due time.
Thank you.
All right.
Thank you. We look forward to coming back.
Thank you very much for your presentation.
Forward to coming back with updates to follow up. with more
Absolutely,
questions. Thank you.
absolutely. I'm really super curious to know what's going to happen a year from now, what you're learning from this process, and how you'll use that to improve what you're doing and addressing the barriers that inevitably are going to come up throughout the process. So, thank you.